come to you that by use of this various tools that we have applied in science and technology, we have been able to connect to 9.2 lakhs of children through the INSPIRE program in the last 4 years. It has been possible to mobilize young people, take interest in science and technology, and even pursue research as a career. And it is our firm desire that under this particular scheme, we create a special window for the healthcare professionals to become scientists and researchers in this area. It is necessary for us to get a special window. It is necessary to create a special window because we believe unless we bring a special opportunity, many clinicians will not take to research. Therefore, we believe science and technology will take a special role for creating healthcare professionals in this area, research professionals in this area. Maybe the pay packages need to be different. So we are planning to create a special window within the INSPIRE framework for healthcare research and to bring about a transformational change in SMT system. With this, I'll stop, and if there are any questions, I'd like to take. Thank you.
I think you have touched the core points of today's need and how can we address this nationally and in the global interest. I'm sure the participants here who will have a participatory partnership model to address these three major issues that you have touched upon. Is there any questions for our Secretary?
Dr. Ramaswamy, good morning. This is Ganapati here. Thank you, sir, for your address. I just have one, if you will pardon me, suggestion or observation. There is, unfortunately, at least unperceived barrier between so-called government and non-governmental, private sector, corporate sector, etc. I think so far as science and technology is concerned, we must go beyond that. And may I humbly request you that we should, I don't see why people outside the governmental sector should be disqualified because they are not in the governmental sector. So may I kindly use this forum and an opportunity to request you to please help those who are outside the government sector to also be able to participate in all your ambitious projects.
Between us, at least the Ministry of Science and the people outside the government, we really believe science is global and we require a global citizenry. I agree that the nation consists of many stakeholders. It is not appropriate to factorize them or group them in different pockets and vertical silos. The discussion that you point out to you is not because there is a barrier within the government to interact with people outside the system. Government generally serves the community and the stakeholders. The country has many components. But what happens here when you convert in the science sector an idea from a mind to a marketplace, there are several layers. Knowledge goes to know-how, know-how goes to show-how. It turns out the private sector entities primarily are focused in areas where they connect to people and marketplace, while the scientists working in laboratories, in the cocoon of laboratories, if I may say so, work within their own minds. Therefore, there are some more organizational asymmetries rather than lack of intentions. And I assure you, as far as the affordable healthcare agenda is concerned, we can set up a transparent private-public area from our side.
Thank you, Dr. Ramaswamy. I think that was exactly what the audience was looking for and exactly what the people of India are looking for, more specifically the healthcare providers. As the Honorable Secretary is aware, 80% of healthcare today is delivered in the private sector. We need the help, the support, the policy and the vision, as well as the hand-holding, to bring some of the latest scientific advancements through the private sector to reach the people. We also definitely look forward to policy and strategy which will move forward with this change. I have one more quick question, but before I hand it over, I'm going to thank you specifically for your powerful appreciation of the scenario that the country is in, the need for access, affordability and availability, and the incredibly subtle way in which you brought about the difference between a transition, which is more mere growth and movement, to the power of a transformation. The power of the transformation, sir, is really what we're seeking, and we want to do it together. One last question, but really from all of us sitting here in Hyderabad and everyone from across the world, thank you so much. But one question.
Thank you. Thank you so much, Honorable Secretary. I am actually looking forward to efforts to increase affordability of healthcare. My concern at this point, after hearing the session and also looking through the trade exhibition, is that as a common man, even though we have access to healthcare, but it's not affordable. And access is there in cities, not in rural areas. So how can we combine the three components of healthcare necessity, that is access, affordability, and availability, with government's help? Because most Indians cannot afford that.
Well, you have talked to my conscience, and I thank you for this question of high social consciousness. I am very proud of young people in this country today. It took me about the age of 46 to become more socially conscious, but some of the young people in this country are socially conscious at very early ages. I'm very proud of you for this question. The fact of the affordability is a very crucial issue for a country of our magnitude and size. And I also will repeat once again, that the rest of the world where the medical care research, healthcare research and the development processes and regulation processes are very expensive, we have made a very strong policy statement in our own country system. When the large percentage of the R&D costs in a country like India being met by public sector, it becomes extremely crucial that we emphasize the importance of affordability in this process. We have a responsibility, and I assure you from the government, when we devise the science, technology, innovation policy, we will have a special focus on affordability of the healthcare system, where we make the government not just a partner, but a benefactor to the people of this country. And this Science, Technology, Innovation Policy of 2013 is being formulated at the moment, and we will ensure that there is a special focus on increasing the affordability of healthcare costs through research, through technology, and through viable partnerships, which is in my case public, private, people, and a partnership among all of them. Not PPP, but PPP, where people partnership becomes important in affordability issues. And I thank you for this opportunity. I enjoy talking to you. Thank you very much.
Thank you, Dr. Ramaswamy. The patients will be very happy to hear about the PPP. I think you've given us, besides your incredible conversion from knowledge to know how, to show how, to do how, and to use how, the PPP is also powerful. Thank you so much, sir, for being with us this morning. Let me assure you that every member of the audience is committed to not just the aspects of availability of healthcare and growth of the sector, access to every member of our population, and this is geographic as well as financial access. But I think we're adding one more element or dimension, is that if we use IT appropriately and the power of drug discovery in the pharma industry, we will create a sustainable healthcare system. Because at different points of the time, in most of the advanced countries, they have managed access and affordability, but have not captured the sustainability. What India must look for is this combination. And with your help, sir, with the idea of the PPP, I'm sure we can do it. Thank you so much.
Thank you very much.
We will now shift to the next video conferencing session. Samir K. Brahmachari. He is also the Director General of CSIR from New Delhi, and we will be shifting over to him. May I also request that anyone who'd like to ask a question, raise your hand to the volunteers at the side or move forward so that you'll also be focused on the video. I've been assured that this room has very good connectivity.
Thank you. Yeah, I can hear you.
It's a great pleasure to see you here, sir. We would have loved to have you in person, but we understand that the Parliament is in session, and thank you for taking the time to connect with us. We are here in Hyderabad, over 500 people in the audience. We have speakers from over 20 countries and delegates from over 33 countries with us right now. You're also being viewed live on webcast. The topic or the theme for the conference, which is transforming healthcare through IT, has been through a series of discussions and debates. This is the third year that we are conducting this conference, and we'll very much look forward to hearing you, sir. The use of IT with special interest in research institutions, how we can cooperate and collaborate using the internet, because we strongly believe that by bringing out new methodologies to treat and cure people, we will be able to enhance the access to people in different parts of our country, improve the affordability and availability, and also create sustainability.